Okay, welcome to our webinar, How Doulas Can Help Disabled Pregnant People. This is being presented by our National Center for Disability and Pregnancy Research. Um, I have we're going to have simultaneous American Sign Language interpretation available. Next slide, please. To view the ASL interpreters, please click on the interpretation button that looks like a globe at the bottom of your screen. A small menu will appear and click on American Sign Language to view ASL in a pop-out box that you can move around your screen. Thank you to our ASL interpreters today. And we also have closed captioning available. To turn captions on, please click the CC button at the bottom of your screen. Next slide. So my name is Nicole Lamerson, and I am a research associate at the Lurie Institute, working on our disability and pregnancy, as well as our disability and parenting research activities. I am also a physically disabled mom who uses a wheelchair. As a brief visual description, I am a white woman with my light brown hair pulled back in a ponytail. I'm wearing navy blue headphones and a pink sweater with a pink and gold necklace. I will be moderating today's discussion as well as our question and answer session at the end, which I'm going to get to Q&A in just a second. Please use the chat to let us know if you have any accessibility issues or concerns. For example, if you cannot see the interpreters. We have someone monitoring the chat specifically for accessibility concerns. We will be sending links through the chat throughout the webinar, and we will also be sending those links to you along with the webinar recording when it's ready. We're really hoping to have enough time at the end for questions. To that end, to ask or submit a question, click the button with two speech bubbles that says Q&A on your screen. Feel free to send us questions at any time. This webinar is being recorded, and we will email all attendees the recording once it is live, and we'll post it for you to view on our website and our YouTube channel. For those of you who opted for the ICEA contact hour, we will send your certificate via email by mid-June. Only attendees who view the webinar live will be eligible for the contact hour. If you did not register for the contact hour on the webinar registration page, but you would like to receive it, please email us at Lurie, L-U-R-I-E, at brandeis.edu. Next slide, please. The contents of this presentation were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. NIDLR is a center within the Department of Health and Human Services. The content is solely the responsibilities of our presenters and authors today and does not necessarily represent the views of our funders. Okay, I'd like to introduce our speakers, Taylor Banks and Dr. Brandy Bentley. Taylor Banks is the mother of 3 with autism spectrum disorder, ADHD, and anxiety. 2 of her sons are also on the autism spectrum. After experiencing challenging pregnancy and birth experiences with her first 2 children, she began searching for better support and resources. That journey led her to doula care, which completely changed her experience, helping her feel seen, supported, and understood. She is here to share her story and highlight the importance of accessible, informed care for individuals with disabilities during pregnancy and childbirth. Taylor, we are so glad you're here today. And Dr. Brandy Bentley is an assistant professor in the Department of Family Medicine at the University of Michigan. She is also a community-based doula in Detroit. Her primary research interests focus on advancing reproductive and perinatal health for individuals with disabilities. Her work centers on identifying disparities in outcomes, optimizing clinical care delivery, and strengthening community-based supports. She integrates health services research with community engagement, drawing on her experience as a community-based doula in Detroit to develop and translate interventions that improve maternal and family health. And I just want to note during our discussion today, when we talk to Taylor about her doula care, Brandy was her doula, which makes this webinar just really exceptional. And on that note, I'm going to hand it over to Dr. Brandy Bentley.
Thank you, Nicole. All right, awesome. Well, welcome everyone, and thank you so much for joining us for today's presentation on how doulas can help disabled pregnant people. We are very, very excited to be in community with you all today. I will be up here very briefly. So this is a breakdown of how today's session will go. I will spend the first 15 minutes walking through the evidence base, so providing a very high-level overview of some of the barriers disabled birthing people face. I'll talk a little bit more about what doulas do and why this conversation matters, especially right now. And then we'll pass it to Taylor to have a discussion exploring her firsthand experience. And we're also mindful that there's lots of questions and excited energy from the folks in the room. So we've also reserved 10 minutes for some open Q&A at the end. So to get us started, I just wanted to provide a few stats that help us understand the prevalence of disability in pregnancy. According to 2022 data, more than a quarter of adults in the United States report having a disability. And disability is a very broad umbrella term that encompasses mobility impairments, chronic pain, sensory disabilities, intellectual and developmental disabilities, psychiatric disabilities like bipolar disorder and post-traumatic stress disorder, and other chronic illnesses. And so when we look specifically at people who become pregnant, research estimates that approximately 1 in 5 individuals identify as disabled. That is a really substantial portion of everyone going through the perinatal experience, yet the healthcare system was not designed with this population in mind. Standard prenatal care was really built around an assumed body, an assumed set of abilities. And if you fall outside of that, the burden of navigating care and the gaps in care lands entirely on you. And I also want to note that the consequences are disproportionately impacting those who are already navigating the most barriers. And so disability doesn't exist in a vacuum, but it intersects with race and income, language access, geography, insurance status, and all of these other parts of our identities. And when you layer those things, the compounding effects for certain groups are very serious. So I want to spend a little bit of time going deeper into some of the specific barriers, starting with environmental barriers. So when we think about receiving prenatal care, standard exam tables require a person to climb up. You have to be able to balance and hold yourself up there, sometimes hold very uncomfortable positions at the same time. And that is not possible for everyone. So research has documented that inaccessible exam tables were among the most frequently cited barrier by physically disabled women seeking gynecological and prenatal care. And sometimes people will skip appointments entirely because of the lack of accessibility within rooms. There's also limited adaptive positioning support during labor and delivery. So the default lay flat on your back position assumes a level of mobility and core stability that not everyone has. And so, for example, people with multiple sclerosis, cerebral palsy, or spinal cord injuries, some of the positions that we have folks get into during the labor and delivery process may not only just be uncomfortable, but it could also be physically impossible. So we have to think very strategically about how people's bodies show up through this process and what we can do to best support folks. Before even getting to an appointment, transportation barriers is also something that I wanted to note. Because for folks who may rely on paratransit, missing a scheduled ride or not having sustainable transportation can mean that you're not getting prenatal care and getting to your appointments when you need to. The paratransit schedule also doesn't always align with availability for appointments. And so scheduling is not always inclusive of people's needs for transportation. And it also does not consider if folks need longer appointment times, if there's coordination that they need support with getting an interpreter, if equipment setup is not designed for their body or their abilities. There's a lot of things in the process that can make scheduling an appointment and just getting there impossible for some folks. And so when we think about accessibility, I always like to encourage folks to think very broadly about it's not just about getting the care that you need inside the building, but it's getting inside the building. And can you do that? Can you schedule an appointment on the virtual app? Is that easy to navigate? And so all of these layers are really compounded and create a number of challenges within the physical environment. There are also communication barriers that can have a substantial impact on care. So when we go in for appointments, oftentimes we're given written only materials. There's no plain language, there's no visual alternatives, and this can be especially challenging for folks that use augmentative and alternative communication devices. And so a lot of us are familiar with those packets of 10 to 12 pages of information that were given at the end of appointments. And it is very, very daunting to go through that and make sure you understand everything that you need. We don't use short sentences in medical care. There's no teach back methods. And so folks are really left alone with making sure that they're able to understand the content that they're being provided within medical appointments. And I would say that the same is could be true for prenatal education classes, thinking about childbirth education classes, breastfeeding classes. A lot of the times, those resources are universally designed for neurotypical folks, hearing folks, sighted folks, and don't think about the diverse needs that patients are coming in with to make sure that access to information is available for everyone. There's also really fast-paced environments that allow limited processing time. Prenatal appointments are especially fast. So you're in there maybe 15 minutes. You get all of this stuff done really quick. And there's not a lot of time for pause or to make sure that patients understand and can respond in a proper way. Another issue is that providers may interrupt, redirect, or address companions instead of patients. And we see this across different disability communities. So, across individuals with autism, deaf individuals, patients with intellectual disabilities, providers may come in and begin directly talking to the support person or the interpreter and conduct the entire appointment as if the person wasn't there. And that really limits autonomy and decision making and making sure that the patient is centered in that communication. There's also a presumption that disabled people don't have sex and won't become pregnant. So, in addition to clinical spaces and social perceptions that disabled people are asexual, there's also the presumption that disabled folks can't make informed decisions or they're incapable of parenting effectively. And it's really, really interesting because this has a direct impact on care. So, research has found that disabled women were significantly less likely to receive contraceptive counseling, not because they didn't want it, but because providers assumed that they weren't sexually active. And so, there's a lot of gaps that are occurring in care just based off of the assumptions that we bring into the space. We also see that on the reverse side. So, oftentimes, when individuals with disabilities come into the office and they are pregnant, there is an assumption that, wow, I'm surprised that you're pregnant, right? And that translates into implicit bias that happens across the perinatal care course. There's also an assumption of incapacity, and that's particularly damaging for people with intellectual disabilities, psychiatric disabilities, and traumatic brain injuries. The research consistently shows that providers significantly underestimate the decision-making capacity of these patients, and it has an impact on their view of parenthood and what they're capable of. Providers report low confidence and inadequate training, yet formal disability training is rarely offered. And so when providers are filling these gaps with assumptions, they have very clear clinical consequences. And one of those consequences that we see is that non-medically necessary cesareans are used more often, and this is driven by assumption, not clinical need. And so studies have found higher rates of C-section delivery among disabled birthing people, specifically for individuals who are wheelchair users or people with significant mobility impairments, because providers are scheduling those C-sections right off the bat without assessing people's ability to try for an accessible vaginal delivery. And then during the postpartum period, we see higher rates of postpartum depression among individuals with disabilities, home visiting, discharge instructions, and lactation education in inaccessible formats. So, thinking about what's happening in the home and the resources and supports that are available in community setting, not necessarily being able to consider the specific needs of individuals with disabilities. And really importantly, parents with disabilities disproportionately are referred to child protective services and lose custody at higher rates. And so parents are going in with this fear during their prenatal appointments, during labor and delivery. I've supported parents with disabilities who are saying, Brandy, like, we're afraid of what the nurse might think when they see me trying to transfer my baby and I have a mobility limitation, right? Like, what are they going to think? Are they going to think that I'm not capable of doing this? And what is the implications of that? And so these are very real fears that folks are trying to navigate in addition to all of the other stress and challenges and things that come up during the perinatal period as well. And so, given all of this, I just wanted to spend a little bit of time talking about what doulas actually do. And so, doulas are trained non-medical professionals who provide continuous physical, emotional, and informational support before, during, and after childbirth. And in practical terms, this looks like meeting with the families prenatally for visits, understanding their history and concerns and their preferences, and also their access needs. During labor, we're also present during the entire time. And so we're there to support the continuity of care as providers switch in and out on their different shifts. We help with positioning and breathing and comfort measures. And we also help navigate communication with medical staff. And then after delivery, we also provide postpartum care that can look like helping parents process their birth experience, newborn care, parenting support, and resources for advocacy and recovery. And then I think the advocacy piece requires a lot of attention because we are a witness. We serve as a witness and a voice in the room, and that can make an enormous difference, especially for disabled birthing people who are already more likely to be talked over, dismissed, redirected, or ignored. Having someone in the room specifically tasked with ensuring that their voice is heard is essential. So the evidence shows us that um, people with doula support have really great outcomes. And so there's a growing evidence base that is pretty consistent and fairly robust that shows reduced cesarean rates and shorter labor delivery, fewer requests for pain medication and medical interventions, increased breastfeeding initiation and duration, higher birthing person satisfaction and sense of agency, and reduced rates of postpartum depression. And specifically for Medicaid recipients in communities of color, doula care has been associated with more respectful treatment by providers and better cultural concordance. And so this means that the care is actually meeting people where they are, both culturally and linguistically, and that is increased when doula support is present. A really important policy piece that helps us frame today's conversation is the Medicaid expansion of doula coverage. So as of March 2026, 26 states and Washington, D.C. provide Medicaid reimbursement for doula services. And this is something that we're not just seeing with Medicaid, but there's also HMOs and PPOs that have began covering doula services as well. And this is really important because Medicaid recipients are disproportionately disabled people, people of color, and low income households. So these are folks who are having some of the most adverse risk during the perinatal period. And having Medicaid cover doula services creates a big shift in access because prior to this, people were paying exclusively out of pocket for doula coverage, and it can be quite pricey, which limits access. And so, this is a really great thing for equity, and for the first time, it really provides consistent one on one support at scale to those who need it the most. And so, something that I want to sit with here is a myth that circulates in maternal health spaces. I think with this expansion, we see a lot of conversation coming up with the idea that expanding doula access will fix the maternal health crisis. And it won't, right? Like the United States has the highest maternal mortality rate in the high income world, and doulas aren't going to be able to reverse that on their own. And so while we provide a lot of meaningful, evidence-based, and life-improving resources, it serves as a band-aid, and that band-aid is not enough to take care of the systemic infection that's underneath all of that. And so what's still needed is that the coverage alone is not enough. Like we have to make sure that doulas are being trained in disability informed care, hospitals are accessible, and that providers are being held accountable for harmful bias and harmful treatment in that space as well. So as doulas, we're able to buy time and reduce some of that harm while the larger work continues to happen. And I think in and of itself, doula care is disability informed just in the way that it operates. We are taught to follow the client's lead. So in doing so, we recognize that every disabled person's needs are different and we don't make assumptions. We're also huge on accessible communication. So a lot of my work is translating what's happening in medical spaces to plain language. I check in regularly with my families, allow time to process. During appointments, I'm texting families links and pictures to everything that the providers are saying to make sure that they have a full understanding of what's being told and the decisions that are being made. We also are proactive about accommodations. So, because we work with families for the entire perinatal continuum, we're able to advocate for access needs before labor begins. And we're also in the room, so we can speak up when a disabled person is dismissed, overlooked, or denied accommodations. There's a big piece of continuity and trust because we built those relationships over a long time. And then, in alignment with disability justice, ideas of collective access, interdependence, and full participation as rights, not accommodations, is something that is really situated in the core of doula care. And so we recognize that we need one another. We can't do this work, we can't sustain ourselves, and we can't thrive if we don't have each other. And so I think those are some things that are really built into the nature of disability of doula care. I have a few examples of things that I do specifically to support disabled families that I've done within my work. And I will talk more about these in depth during the discussion that we have with Taylor. And so we can move to Taylor's story now. And before we do so, I just wanted to take a moment to acknowledge who Taylor is in this space and what it means for her to be here and all that she brings. And I think really importantly, as we're having conversations about disability justice and what that means in practice, Taylor's story is not a case study. She's here to bring her expertise and her lived experience as a disabled mom who has navigated these experiences. And her experiences are knowledge and they carry so much weight in this room. And she's generously offered to and agreed to share a part of her story. And I really want us to listen with intention and care because the details about who she is and what she wants to share are her own. And it's not for us to try to illustrate or put a human face to the research that I just walked through, but instead really thinking of Taylor as a co-creator and the solutions that we will develop to better ensure access and equity for disabled birthing people. And so with that, I will pass it on to Taylor and get our discussion started.
Okay. I'm going to be moderating this discussion, but my goal is to speak as little as possible. Thank you so much, Brandy, and thank you for that introduction. Um, Taylor, can you introduce yourself to us and tell us a little about who you are and your disability identity?
Yes. Hi. Am I too low?
You're perfect.
Okay. Okay. Hi. I'm Taylor Banks. I am 31 or 32. I have three kiddos. I have two that are on the spectrum, one verbal, one nonverbal. I am also on the spectrum. I have ADHD and I have anxiety, severe anxiety. But yes, does that
Thank
answer your
you.
question? You're welcome.
Sure, sure. Can I ask what your previous deliveries were like without a doula? So, for
Yes.
example, did you ask for accommodations?
As far as my oldest and my second son, most of my appointments they talk over me, so they didn't really explain a lot of what was going on in those appointments. So I didn't really take a lot of information, and they didn't talk to me about breastfeeding. They didn't talk to me about pain medication. They just kind of was like, "This is what we're gonna do," and I felt like I had no voice to be able to stop those things. Even when I told one of the doctors that it was uncomfortable in my abdomen and I felt like I was going to die, she was like, "Well, just hold on just a second." And she continued what she was doing. She didn't even stop to take a moment to see what was going on. Also, in my second pregnancy, I lost a large amount of blood, so much that I almost passed out. And I'm not saying that that's their fault, but I feel like there could have been communication to talk about those things and what may happen and what may not happen, and there was none of that. With with Brandy, she changed my life. She changed everything. Every appointment that she was at, she broke down everything. She made sure to hold on, wait a minute, let her process that information. Do you have any questions, Taylor? Do you have anything that you want to say? And that allowed me to get more understanding of those situations. See, also, my pregnancy, this was the shortest labor I've ever had. I went from 1 centimeters to 6 centimeters in an hour because of her. She also let me know that I don't have to lay on my back. I can turn on my side. I can turn like on my knees and wiggle, and it helped with everything. I know that may sound silly, but it helped with everything. Um
That is
her
so wonderful to hear. Go ahead.
she's absolutely amazing. I also want to put in there that she wasn't, when I asked for a doula for someone and for care, they told me to look on the back of my car and to call, and they gave me a list of people to go from. I called one of the people, and the lady, I told her, "Hey, I'm on the spectrum." She was like, "Okay." She was very pushy, very demanding. I didn't have a voice with her. Brandy wasn't registered on my medical. I found her and I said, "This is the person that I want to be there for me." And she went and did all the things necessary to become my doula. So she wasn't even supposed to be working for my medical, but she took that extra step to be that person. And I didn't know her. This is just somebody I saw, and I said, "I already love her, and I I want her in the room with me." She brought me different sensory things. She made sure the lights was off. She made sure I had light noises. She made sure that it was quiet. Anybody that come in and out of the room. She brought music. She brought these combs that you stick in your hand for a different sensory effect to take away the pain. She was amazing. She was amazing. She was nice to everyone. She wasn't mean or taking over the spotlight. She was very, very, very kind. Very great experience. I would have 1,000 babies because of her.
I feel like that's the ultimate compliment. Um, can I ask how you approached the topic of your disabilities with Brandy and what that was like?
Yes, I messaged her and I said, would you like to be my doula? And she said yes. And I said, well, I am autistic, so I may not want to be in person a lot because I don't like to be touched. But she said, I can work with that. So we did yoga online. She helped me do all my labor things online. I went up until 39 weeks and 39 weeks and 2 days. And I, yeah, she's just amazing. I don't know. Do you have any other questions for me?
Did you did you always meet online? Were they virtual visits until you had until your labor started?
There were virtual visits at, like, if I'm at home, yes, but my appointments,
Mhm.
she would show up for me there. But it was virtual because I have two autistic children, and my youngest at the time, he needs my care 24/7. So I couldn't really meet in person or he would elope. So it was important that we met online a lot of the times.
It sounds like you and Brandy had an exceptional working relationship together that was sort of a whole person and whole family approach, which I think we want in all areas of medicine, but also for all disabled people seeking out this care. And I'm wondering, Brandy, if there was anything else you wanted to add to that or anything else that Taylor has mentioned in terms of how you met her and how you together as a team found the best ways to support her.
Yeah, I think it's a really interesting space because most of the families who I've supported who are disabled have self-disclosed before even meeting for the initial interaction. And so I have a website and I say that this is my research, this is my work, these are the folks that I'm interested in supporting. And so a lot of times people are finding me through that way. So through the state of Michigan, we have the Michigan Department of Health and Human Services has a doula registry capturing all of our doulas who are Medicaid enrolled within the state, and you can list your website there. So a lot of times folks are going there and they're finding me, and they're reaching out and saying like, "Hey, I have this disability. Can you support me? Can we make this happen?" And I think through my experience, it has just been a lot of leading with humility and understanding that every experience is a learning experience. Um, and there's so much work to do to just make sure that we're understanding individuals and families and their unique experiences on a one-to-one basis, and then filling those gaps as needed. And so everybody's experience is very different. And yeah, I think that's something that's been important to me because I think there is a growing conversation around disability and pregnancy, but in doula spaces, we're not trained as doulas on how to support disabled families. There's not very many resources at the intersection of disability, pregnancy, and postpartum support. And so I think being in that space and creating that space within my local community, and being able to allow folks a space where they feel safe and seen is so important. But it also requires, like I said, that I'm leading with humility and saying, I'm not going to have all the answers, but who can I connect with and who's in my neighborhood, who's in my community that I can connect you with that may know more, can point you in the right direction.
That's fantastic. I think it sometimes when working with disabled clients or disabled patients, sometimes folks just want to find the instruction manual, and I think we know, and this conversation is proof that the instruction manual doesn't really exist, but that we can find our way through. And in the related to sort of finding our way through, I'm wondering, Taylor, how you and Brandy worked through finding accommodations and pain management solutions and supportive solutions that helped you during your labor and delivery.
Can you hear me now?
Yes, it's wonderful to see your face again.
Well, she actually came up with the idea of, we go, she had a long list and we dedicated about 3 hours going over what accommodations that I want, because I didn't even know that I could ask for accommodations like that. When my previous pregnancies, I had asked, I think I asked when I was in labor for a yoga ball, and it took a long time for them to come. And when they came, they didn't really want to give it to me. They didn't really want to help. They weren't nice to me. It wasn't a helpful experience or a happy one. But even with my previous pregnancy with Brandy, with all those people who had the bad attitude, who didn't want to help, I didn't have to deal with none of that because she was ready. She came to the hospital with a bucket for me to take my placenta, which I didn't even know I could do. She also brought me a peanut ball, which I didn't even know was a thing. She also brought all of the accommodations, everything that she did to make the room relaxing, she brought herself. It was nothing from the hospital. So she changed all of that. So we went through step by step. Do I want a female doctor or a male doctor? Do I want the lights on, the lights off? What do I want? What do I want to do if this happens and if that happens? Do I want pain management? What can I do that's different other than taking pain meds? And she provided a solution to all of that. And I can't thank her enough. I can't thank her enough.
That is so wonderful to hear. Brandy, can you talk a little bit about the ways you think about accommodations for labor and delivery for your disabled clients?
Yeah, again, I would say I think this is something that is so naturally baked into doula care. And so, with all doula clients, we sit down and spend a ton of time around birth planning, like Taylor was mentioning. So, we have a really comprehensive birth plan and we go through every single area and ask folks what their preferences are. We note it if there are histories that they want their providers to be aware of or details that are really important. We can write that on the board in the labor and delivery room so folks don't have to constantly repeat themselves because that can be overwhelming and stressful. And so that is something that I start with and try to think through is for labor and delivery, here's a plan. I do postpartum planning with families as well. So once you transition home, do you have therapy appointments in place? Who are your go-to support people? What task do you need the most help with? And I think that allows me to get more into if there are specific access needs that they have. I've supported a lot of individuals with mobility disabilities. And so it's interesting because I've been thinking about this question a lot of like, what does it look like to have accommodations? And what people need the most help with is so simple. The things are so simple. And sometimes I think we complicate it and think that we have to have this whole manual of like, this is how you provide doula care to this population. And it's really just meeting people where they are. I think it's like the basic tenets of doula care, the basic tenets of social work. It's like, who is this person in their environment and what do they need? And so, for example, for one of my family's mom had a physical disability and she could not walk long distances. And she said, Brandy, can you come to my appointments with me and push the wheelchair? Yes, I can do that, right? Or it was like, can you help me get dressed after this appointment? Because if I do it on my own, it's going to take me 30 minutes and I need to get back to work. Yes. Or can you come to my house and we make a diaper station that's on the first floor because all the bedrooms are upstairs and I need to be able to have access to diapers downstairs? Yes. And so it's like very simple things that I think we don't think about. And that's how I've filled a lot of gaps is connecting folks to parent groups on Facebook so they have other parents with similar identities and they can build that community out. But I keep saying this. I kept thinking about it, but I think it's a lot more simple than we give credit for. And it just really requires us to be present and listen and meet people where they are.
Thank you. I think a lot of us with disabilities have been saying that to various providers for a lot of years. Um, I know, Taylor, you mentioned that your labor progressed really quickly and you were supported. You were well supported and you had accommodations that were helpful for you. Is there anything else you want to mention about your labor and delivery experience that we didn't touch on?
Yes. One thing that she did different than everybody else is that she asked me, "Do you want to breastfeed?" And I said no. And she respected that. And then now here I am, 6 months into my breastfeeding journey. She met me at that point and was like, if this is what you don't want to do, then we don't have to do it. She didn't push it, but I was able to navigate and look into that on my own. And now she's taught me how to do everything. She put me in places with the right people to be able to learn how to do that. As a person who doesn't like to be touched, she helped a lot with that. And now my daughter is thriving. She's 6 months and she's 23 pounds. She's, she's chunky. She's so cute and she's healthy. I what I wanted to say about that is that that was the quickest downtime I've ever had. I went home in 24 hours. Baby was healthy. I was healthy. I had no bleeding. Well, I had bleeding, but I had no excessive bleeding like my previous pregnancies. I was feeling better. I was getting up and starting able to walk. I was sleeping better, and she still checked in with everything. She still was like, "Do you want me to watch the other two? Because I know that you need time to adjust." She also had my placenta for me, and I still didn't know what to do at that moment with it. And we looked into ways of where to put that. So yeah, she helped with that too.
I'm I'm just floored by this conversation, and I think there are many in our audience who are probably feeling similar. Um, can we talk a little bit about postpartum a little bit more? I'm wondering, Brandy, what the time after birth and once you got home was like for you. I know you mentioned decision making around breastfeeding. Were there any accommodations that Brandy suggested or anything that you figured out on your own that were particularly helpful in the postpartum period?
I I'm okay. Most people may overlook this, but she was a positive influence after my pregnancy. Most people don't think about the positivity. Sorry, my son is on his way to come see me, so you may hear
That's
him in the
okay.
background. But she was continuously positive. Always spoke to me about the real issues and gave me positive feedback about everything. She was understanding with every issue. She was understanding with every issue, and she was like, "What do you need? What do you need? I can provide for you." But my point is that she was just a positive person, and you need that when sometimes your mind is saying something different and your body is saying something different, or your body, you have to get used to the new body that you have after having a child. And she was always that positive of, I have a community of people, but she was always someone that was there in the room and seeing what I went through and understands. And yeah.
Thank you. Brandy, when you think about postpartum, are there any accommodations or methods or things that you think about for your disabled clients, knowing that people with disabilities are so heterogeneous?
Yeah, that's a good question. I think the first thing that comes to mind is just understanding all of the other social influencers of health, and environment. There's so many needs that folks have that I think doulas are well positioned to meet. They're kind of like low-hanging fruits. And so sometimes my postpartum support looks like picking up a grocery order from the grocery store and dropping it off. Like there's folks who have limited transportation and need support just with things like that. Like, can you get grocery for me? Or can you come over and help with the laundry? Or can you take the garbage, roll the garbage can out? Like there's things specifically for my parents with mobility disabilities where they asked me to come like, Brandy, these boxes have been in the floor for months, right? And like, I need you to unpack them and put them in the closet so that I can move this and have a walkway to get through with the baby. And so, yeah, I think it's just being very open, and I try to send a list of different things that I can do and also honor that postpartum period is so sacred. And it takes a lot. Like it takes a lot of time for parents to adjust to the new season. And so I continuously send messages or just inspiration to let them know that I'm thinking of them and they're not alone, even if they have really supportive communities and families. It's nice for folks to say, like, hey, I'm thinking about you today. Do you need anything? So when the time comes up and those needs do arrive, they feel like they have a space to go to and can get support in that way.
Okay. We're going to open it up for questions in just a minute, but for the discussion, I'd like to let Taylor have the last word. And question I want to ask you is, how would you describe your overall experience of becoming a parent as someone with a disability? And how has your experience with Brandy impacted your
Well,
parenting?
my experience in becoming a parent, while I have a disability, scary and amazing. It is rewarding, very rewarding. It has its tough moments, but if you have the right support system, you are able to do you're able to do it. You could do it. I love being a mom. I would never change anything about that. I love my children. They are amazing. And having Brandy made me feel like I could do it a million times because she's awesome. But yeah, knowing that I have access to a doula who is as amazing as Brandy, it really changed my perspective on everything. It made me realize I have a voice. She's the reason why I'm sharing my story because she she changed everything for me. I went into my appointments thinking that no one would ever listen to what I'm saying and that I just have to do what they say, and that's that. But she made me realize that I do have a voice and I can like things the way that I like them. I don't have to do them the way that the doctors make you do them. I know that the doctors know the right ways, but sometimes they don't. Sometimes they think that it's one fit all and it's not. So having her is amazing. If I ever do have another child, she is the first person that I will text. Even though I still talk to her, she still is amazing. She still brings my children things because she's just awesome.
Oh my goodness. Taylor, I want to thank you before we head into Q&A. I think talking about labor and delivery and postpartum and parenting is very, very vulnerable. And it is exceedingly vulnerable when you are a person with a disability. And I want to thank you so much for being so generous with your story. I feel like you have impacted a lot of lives today with your story. We're gonna move on to Q&A. Um, and let's see, I'm gonna start here. What accommodations can be asked for outside of the usual birth request of yoga balls and low lighting? How can those requests be documented? Oftentimes, when I advocate for a client, practitioners view it as asking too much or don't believe the person has the needs. I'll let you take. Do you want to take that one, Brandy?
Sure, I can start us off. That's a really good question, and I think it depends person to person. It also depends hospital to hospital. As I'm sure the person who asked the question is aware, it's so different. Like different hospitals have different cultures, and what they're willing to do looks different. I found the most success is in documenting things in the birth plan. And what I have families do is instead of sharing the entire birth plan, I make two versions. So I have one that has all the information in it for them to keep and have a copy of, but then I make a smaller version that they can give directly to their providers, which is like, what are the most high level things that I really need my providers to know? And I'll highlight things and put things in red text. So it's like a short document, so the nurses aren't having to flip through multiple pages because some of the things are relevant to the family and some are relevant to the clinical needs. So if there's any clinical accommodations that are especially important, I've had good luck with putting them in that short version of the birth plan and bringing that to the hospital upon arrival.
We have a question here from a disabled doula. We're not naming the violence and disrespect women and birthing people endure acquiring reproductive health care and pregnancy services. How can doulas, I am a disabled doula, organize to address the upstream structural barriers and prejudices that are endemic in obstetric and reproductive health circles? It's an excellent question.
Yeah, that's a really, really good question. I would say here, it starts here, right? Being able to connect with other doulas who are doing the work. Like I said, it's a growing space. It's a really growing space. And so I'm based in Detroit, Michigan. And I've been doing a lot of work locally just to build awareness around the importance of disability and what doulas can do to better support disabled populations. And so I think using that momentum to mobilize as much as we can and connect with others who are situated in this work to start organizing around some action is a great idea. My primary strategy so far has been targeting specifically Black maternal health organizations in Detroit and building partnerships with folks here locally and just bringing that disability lens. And then as we're having policy conversations or we're talking about like paid maternity leave and all of these things, we're now shifting the focus to say like, how does disability, where's disability fit in here? Are we thinking about intersectionality? Where's disability? And so I think specifically within my own personal work, I've just been trying to bring a disability lens to all of the other maternal health conversations that I'm in, but definitely using spaces like this to identify other folks who are doing shared work and connect.
And another one for you, Brandy. Do you charge more as a doula for disabled parents since their needs are higher?
No, I charge the same rate. And to be honest, I do a lot of pro bono services in Detroit. And so because it's just a passion area of mine and something that I currently have capacity to do, I will take folks on free of charge. And that's just something that I try to fit within my scope because I do doula work, but I also work as an assistant professor. So I have to be very strategic about how many doula families I'm able to support. And so I just balance it in a way where I'm able to support families for free and then the other payment methods, if that makes sense.
Does make sense. Um, would you classify your disabled clients that you work with? Are their needs higher or are they different? Or how do you think about that in relation to non-disabled clients?
They're not, Nicole. And I've seen this. I think someone mentioned this in the chat. Like we've been having these conversations for a long time, a long, long time. And I think specifically in my work, I serve largely Black disabled folks in Detroit. And so when we think about anti-Black racism and all of the other forms of oppression that have shaped clinical outcomes and people's perinatal experiences, I am not supporting individuals with disabilities. It's not taking me more time. It's not taking me more energy. I am showing up. If I had to itemize it, it would look the same as the support that I provide to non-disabled families.
Thank you so much. And thank you, Taylor. Thank you, Brandy. This has been a phenomenal hour. Could we share the slide deck very quickly?
Can I answer a question I saw in the chat?
Yes, yes, please, Taylor. I didn't see the
Okay.
chat. Please go ahead.
Someone said, I can't remember the actual question, but they said, how do you ease the tension with the nurses? as a doula. And just from my experience of having Brandy didn't focus on any of the nurses. She focused on me and my experience and how that made me feel. Because where I go, they have rotating nurses, so it was always someone different. But a lot of times she let me know not to take it personal. Focus on me. Look at me. It's okay.
That's great advice. That's wonderful advice. And I feel like it's advice every pregnant and laboring person should hear. Um, Very quickly, one of the things that we do here at the National Center for Disability and Pregnancy Research is platform the stories of disabled pregnant people and disabled parents with our sister site. So to that end, we have a blog, and this is a community blog, and we often ask folks to contribute. So if you're a disabled parent and you've listened to this today and you have a story of how a doula helped you with your pregnancy, we would love to hear from you in the form of a blog post. We do provide an honorarium for our blog posts. There's no free labor or no free writing here at Lurie, and we would love to hear from you. Next slide. And this is our contact information. You're welcome to reach out to me at this email address. Any questions about CEUs or anything you've heard today, I'm happy to help. I also provide some technical assistance for disabled parents and disabled pregnant people. And I want to take a moment and thank our panelists once again for just a fantastic webinar. I hope everyone has a wonderful day. Bye-bye.